Hi students, myself Dr. Mrs. Kundu, a professor and HOD of Physiology from Motibala Homeopathic Medical College, Nasik. Before starting our topic today, let me share one incident with you. It is a matter of long back, almost 3 to 4 years back, when I was just walking. Suddenly I got some sound, irritable sound from my back. I looked back obviously, and what I found, that old gentleman was just walking through the road and he was dragging his leg with shoes against the road, and that's why a particular irritating sound was producing. When I looked, he was just walking with his attendant. When I looked further, when I observed him further, what I found, that he is not able to walk properly. In a very stiff gesture, he was just walking, he was dragging his shoes against the road, and when he was walking, he was bending forward, and then in that situation, in that attitude, he was working. Suddenly, one of first year student who was staying nearby, he met me and he proudly told me, "Madam, don't you think that it is a case of Parkinsonism?" Till then, I have not observed that patient properly. On telling, I again observed and I saw that when he was hanging or swinging his hand like this, he was having tremor on his right hand. I was so happy that even a first year student can diagnose at his level that it is a case of Parkinsonism. Yes students, today my topic is Parkinsonism. Now here two terminologies are there, Parkinsonism and Parkinson's disease. A mild difference is there. Parkinsonism is a general terminology where, along with the Parkinson's disease, other neurological involvements are there, whereas Parkinson's disease is purely a disease involved due to death of some particular brain cells. Now let's see here. This is Parkinson's disease. Parkinson's disease is a neurodegenerative process. Itself refers to dysfunction and cell death of the portion of the brain what is producing dopamine. Dopamine is a neurotransmitter, a chemical substance, and it transmits signals between brain and nerve cells of the basal ganglia. This particular area is partially responsible for making controlled movement in the body. Now let's see what is Parkinsonism. Parkinsonism is a general term that refers to a group of neurological disorder that causes movement problem. A person who has Parkinsonism will also have another disorder, and that causes additional neurological symptoms. This may start with the dementia to the inability to look up and down. Now we are coming to our topic. Before that, let's see who are the well-known personality of the Parkinsonism. Michael J. Fox, he is an American actor. Muhammad Ali, you know, he is a great wrestler. Katharine Hepburn, she is also an actor. Pope John Paul II, he is a philanthropist and he is the head of Catholic Church of Vatican City. And then Mao Zedong, etc., etc. These are well-known personality who has suffered with the Parkinsonism. Now the introduction part. Parkinson disease is a brain disorder, already spoken that it is a brain disorder. Of what area of brain disorder? The basal ganglia, and particularly one neurological pathway what is discharging dopamine. And this disorder gets worse over time as the age progresses. The symptoms of Parkinsonism are also progressing. It causes nerve cells in a part of brain called substantia nigra to die. This part of the brain is important for controlling movement. That's why people with Parkinsonism often shake the hands or slow in show other abnormal movements. Treatment can help with the symptoms, but unfortunately, there is no way to slow or reverse the condition. Research shows that both men and women equally suffer, but in recent research it is shown that men are 1.5 times more common, and it is more common in older people. After 50 years of age, Parkinsonism may develop. Now we will go to a little bit depth. It is a disorder, disease, result from degeneration of nigrostrial pathway of basal ganglia. What is nigrostrial pathway? It is a neurological pathway of the basal ganglia. Nigro, that means substantia nigra, and strial, that means corpus striatum. So degeneration of nigrostrial pathway of basal ganglia, what is containing dopamine. With the age, there is progressive loss of dopamine and dopamine receptors in basal ganglia. When this process accentuated or very noticeable, the result Parkinsonism or symptom of the Parkinsonism develop. Now Parkinson's disease, that means we are focusing mainly on the disorder, what causes due to death of the or slow activation of the nigrostrial pathway. The Parkinson disease is named after its discoverer, James Parkinson. It occurs due to damage of basal ganglia. It is mostly due to destruction of the substantia nigra and nigrostrial pathway, which has dopaminergic fibers. This disease is also called as paralysis agitation. All are discussed. Now let us see the causes of Parkinsonism. There are different causes. The very first causes is idiopathic causes. That means the unknown causes. Now let us start with the first. Viral infection of brain like encephalitis, injury to the basal ganglia, that means due to head injury, etc. If there is some injury. Destruction or removal of the dopamine in basal ganglia due to continuous use of high dose of antihypertensive drug and so-called drug-induced Parkinsonism. Already spoken, idiopathic causes or unknown causes. Then MPP, methylphenyl pyridinium, that means MPP. So concentration of MPP becomes high in Parkinsonism, and due to that high concentration of this MPP, it accumulates rapidly in the neuron of basal ganglia and ultimately destroyed. So naturally what's happened? Different type of neurological disorder develop. Now let us come to the symptoms of Parkinsonism. There are two types of symptoms basically, hypokinetic symptom and hyperkinetic symptoms. Both hypokinetic and hyperkinetic movements are seen in Parkinsonism. Let us start with the hypokinetic, that means when it is slow. The first one, akinesia, that is difficulty in initiating any movement. The patient will sit in a chair for hours. Brain is very much active. That's why he will think that I have to do this, I have to do that. But he cannot initiate the actual movement. So that condition is called as akinesia. So difficulty in initiating any movement or activity. Slow in kinesia, that is bradykinesia, slowness of the movement. He will do it, but he will perform it in very slow motion. We are continuing with the hypokinetic functions. So among them, one more is there, decrease of automatic associated movements. What are these? That means some movements we are doing along with the voluntary movement. Say for example, when we walk, there is swing of hands along with the steps of my leg. Similarly, when I talk, I have some facial expression to emphasize what I said. So here there are examples: swing of arms during walking, facial expression during talking, etc. Now we are coming to the hyperkinetic effect of the Parkinsonism. It is characterized by three different symptoms. The first one is rigidity, second one is tremor, and third one is fascinate gait or fascinating gait. Now let us see what is rigidity. Motor neuron discharge is increased where in agonists and antagonists muscle. So naturally what happened? Flexion and extensor muscles are not working properly. So naturally the arm or the limbs will be like pillar or it becomes rigid. So limbs develop resistance to passive bending. It is not bending properly, and this type of condition is called as lead pipe rigidity. Tremor. What happened? Due to exaggeration of the movement, ultimately what's happened? There is shaking. There are different type of shaking. Involuntary shaking of the hands or the fingers. It may happen from the wrist, from elbow to the fingers, etc. And accordingly, they are called as tremor. Next one, fascinating gait. Fascinating gait, due to the symptom of fascinating gait, the patient will walk, bending forward in small step, but hurried movement, as if the person or the patient is going to catch the center of gravity. He will not fall, but he will step fast in short step as if something is kept in front and he is going to hold it for his support. Now we will discuss one by one symptom in a little depth. The first one is rigidity. Already I discussed. Due to the removal of inhibitory influence of gamma motor neuron, the muscle tone is increased. I told that it goes to the flexor and the extensor, both the muscle. So this affects both flexor and extensor muscle equally. So the limbs becomes more rigid like the pillar, and that's why the person while walking is not able to bend passively. His limbs are in a rigid condition and accordingly he is just dragging his leg against the road. The condition is called as lead pipe rigidity. Already we discussed about that. Next one is poverty of movement. that is the hypokinesia. Due to the absence of automatic associated movements, there is poverty of the movement. The body becomes statue-like. Face will be masked face due to absence of the appropriate expression. Next one is tremor. First we will see what is tremor. Tremor is rapid, alternate, rhythmic and involuntary movements of flexion as well as extension in the joints of fingers, wrist, elbow. So this is called as tremor, already told. In Parkinsonism, the tremor occurs during rest. It is very important symptom of the Parkinsonism. The tremor occurs during the rest condition. But when the patient is just wanting or when the patient want to hold something, the tremor disappears. So here there is one differential diagnosis with the chorea. In chorea, the tremor will be there always in rest and when is in action. But in Parkinsonism, we will see the tremor is in rest, and that's why it is called as static tremor or the resting tremor. It is also called as drum beating tremor, as many a times the person is doing like this, as if there is some drum and he is just going to beat this. There may be pin rolling type of movement. That means he is just rolling his thumb over the index and middle finger. So these are different type of tremors. So it is also called as drum beating tremor, as the movement are similar to beating a drum. The thumb moves rhythmically over the index and the middle finger. This is also known as pill rolling movement. Last we will come to the gait. In Parkinsonism, the gait is called as fascinating gait. Here what's happened? Already it is discussed that in fascinating gait, the person will bend a little forwardly. He will take short steps but quick step, as if he is going to catch the center of gravity. So in Parkinsonism, the gait is called fascinant gait. The patient walks quickly in short steps by bending forward as if he or she is going to catch up the center of gravity. Patient bend forwards but do not fall. Instead, take short and quick step. Now, treatment for Parkinsonism. See, as there is deficiency or absence of dopamine, so dopamine can be directly injected. But you know what happens? If dopamine is directly injected, it will not cross the blood-brain barrier. So, to compensate this, what is done? Just injection levodopa is given. This crosses the blood-brain barrier, and after reaching brain, it is converted into dopamine. But it is also seen that as symptoms sometimes may be relieved, but there is no such treatment which can reverse the condition. It is a very unfortunate part of the Parkinsonism or Parkinson's disease. Thank you.